I think for this time round, it's obvious that the COVID pandemic, really made it a struggle for all of us in terms of engaging with the wider communities and also um, mobilizing our leaders from the community to get together and discuss or have open group discussions around uh, the program. So I would say that COVID was challenging, but we managed to fulfill that by having a few leaders who are available to contribute towards the planning process virtually. I think learning from the COVID pandemic, I think we already have some steps in place for that, but ample time in terms of planning is very important. Um, because it was very short notice, we couldn't mobilize communities to come in, community leaders to come in. But now, if we're given ample time, we're given notice in advance, we can start that process. Number two, it's very important for the community to know the achievements from the past programs so that we can actually sit together and say what worked, what didn't work, and how can we improve on that. So the community need to go and reflect on the work that they've done, and also it would be meaningful for them to say, okay, these are some of the activities that we didn't achieve, how can we improve on that? So that's just my two reflection on the whole process. The leaders of PEPFAR were really proactive in producing data, and to us, data is a way of measuring results. So we were able to, they told us that this is what we had achieved. They really stuck to the plan. So to us, I always like the PEPFAR program because everyone gets together with their data and it's very focused, and it really gives us how we've achieved some of those programs. And so PEPFAR programs, from the past experience I've been through, they are very good at producing data for us to really understand the epidemic. And also in Papua New Guinea, they're really focused in the National Capital District, so we're able to measure all the indicators that they put in place. So to us, I always learn from the PEPFAR programs that we can replicate in other provinces in Papua New Guinea. So I just want to say thank you to EPCOM for really facilitating the process. Even though we are far away from reality, I really admire our regional partner for really being proactive in helping us advocate for issues and also just communicating with us and updating us on what's happening. So, for example, with the budget cards, this information came through EPCOM, so um, we were really advocating for that, and I was really helpful to be part of the process, so we can tell our donors that there's a big need to support key population programs. So I really appreciate the work that our regional partners have been really standing in for us and engaging us. Because if EPCOM wasn't there, we wouldn't know who to turn to. But for a regional organization to take the lead and then mobilize us, that we have one voice, that's where our voices are very strong, and also our advocacy programs are very effective. So that's all I can say around our partnership in Papua New Guinea with APCOM and other regional programs and other groups in the Pacific who we've sent in the Pacific Asia, that we've stood together to advocate together as one family. Thank you.